24 French Foley's catheter, then what I will do is I just cut 2 rings. You see this, I cut 2 rings. These are, just cut the rings. This is they made a rubber band. Fine. Then what will happen? So just this is already sterilized, so I can cut 2 or 3 rings. Then what I do is just I have to fill the bulb. So you just fill the bulb with 5 ml of air, and then I have to just cut the bulb. Fine. Now you just cut it all around, because we have to, the fundamental thing is to replace, and we can either excise it or you can simply evert the thing. So you can evert it. Now what we do is just put the condom over this catheter. So this is done, and then you take the rings. So you just take the ring and you apply the upper ring between this bulb and the hole of this catheter, hole of the catheter. So you just wound it around only twice, means so you do it twice. This is in between the bulb, and the hole. Can you see this area? Now the second ring, I will be applying the second ring just 1 to 2 centimeter from the this tip, rim of the condom. So this done.
Yeah.
Fine. Now what I will do is I will simply cut this thing, cut the tip of the condom and tip of the catheter together, and this has, can you see this hole? So now the hole is created. Now you see what I have done is I have replaced the bulb of the Foley's catheter with a bigger bulb which is made of condom. Now I have tied both the ends, so this is secure, and I know that length from the tip to the rim, so I know how far I have to introduce the catheter. Now you see I dip it in the betadine. I wear gloves, of course, and wear it in, keep it in betadine for 3 minutes, and then once you have to introduce it, you just, like, this is a patient, this is the uterus, and what I have to do it, should I do it here? Here you will be able to see. So suppose whenever I introduce it, just keep it between 2 fingers and just introduce it, it goes inside, and we have to keep the rim, just keep the rim of the condom at the level of the os. This is the landmark. Fine. Now I will demonstrate how do I fill it. Now while I cut the normal saline bottle like this, दूसरा भर के देना, and just through the bulb inflation port, take the bulb inflation port, through the bulb inflation port I just fill it with saline. So while I am doing it with 1 syringe, my assistant fills the second syringe, so I can do it real fast. And maximum amount of saline which is to be filled, देते जाओ. So generally what we need is around 200 to 250 or 300 ml of normal saline, because this bottle is of 500 ml. So once this bottle is finished, and now you see this is not leaking, this is not leaking. Fine.
Yeah. So
and this is a good drainage port.
Yeah.
And then I just have to connect it to the